In the afternoon is the hardest time to keep awake. So maybe I'll fall into sleep before you do. At which time you wake me up, and I'll keep speaking. Okay. Now, Mrs. White, in her writing, Medical Ministry, page 221, stated, "The Creator of man has arranged the living machinery of your bodies. Every function is wonderfully and wisely made. We may behold and admire the work of God in the natural world, but the human habitation is the most wonderful." Our cardiovascular system reflects the art and science of this wonder. Our cardiovascular system has three subsystems: the lymphatic system, venous system, and arterial system. The lymphatic system is also part of the immune system that helps us fight disease such as cancer and infection. It drains to the right side of the heart. The arterial system and the venous system is the main system. The venous system carries the oxygenated blood along with the waste products back to the right side of the heart, from where it goes to the lung to go through an oxygen-carbon dioxide exchange process before going back to the left side of the heart, from where it gets pumped to the systemic circulations to supply blood, oxygen, glucose, nutrients to our vital organs, all the tissues, every single cells in our bodies. Our heart is the engine of our body. It's the center of the vascular system. There's two functions. The mechanical function pumps blood to the systemic circulations. The electrical function determines heart rate and rhythm. When the law of health is broken, disease results. There are different types of cardiac diseases. When we're born with a hole in the heart, missing a valve, missing a chamber, the heart being upside down, left side, right, that's congenital heart disease. Valvular heart disease is disease in the valve of the heart. Rheumatic fever is still the #1 cause of valvular heart disease in the world. Valvular heart disease can be congenital, can be acquired. Cardiomyopathy is the disease in the muscle of the heart. Heart attack is the major source of cardiomyopathy. Viral infection, alcoholism, endocrine disorders such as hypothyroidism, autoimmune hypersensitivity disorders such as lupus, scleroderma, can all weaken the muscle of the heart. Arrhythmias is abnormal rhythm, a disorder from the electrical system of the heart. Pericardial disease is disease in the membrane around the heart. But our focus today is coronary artery disease, because it's the most common cardiac disease and because it is lifestyle related. The hallmark of coronary heart disease is atherosclerosis, meaning hardening and narrowing of the blood vessels. It is the buildup of fatty deposit, cholesterol, platelets, white blood cells and their immune substances, inflammatory substances, certain proteins such as reactive proteins, calciums, they combine to form a plaque that obstruct blood flow. When it's obstructive enough, it gives us symptoms of angina. When it's completely blocked, it leads to an acute heart attack. But the mechanism of most of the heart attack is due to plaque rupture. As you can see here, the underlying blockage is less than 50%. All it takes is a crack on the surface of the capsule that encases the plaque, and that would invite platelets, other clotting factors to group together to form a blood clot. And that completely obstructs the blood vessel, causing an acute heart attack. Another mechanism is coronary spasm. The artery clamps down so tight that little or no blood flow occurs. It can happen in otherwise healthy, middle-aged women. It could happen in young men and women on drugs. When I see a young person with massive heart attack in the emergency room or in the ICU, he is on cocaine or methamphetamine until proven otherwise. Heart attack can be complicated by a number of conditions, including sudden cardiac arrest, heart rupture, congestive heart failure, cardiogenic shock, valve dysfunction, pericarditis, and stroke. And every single one is life-threatening. Every year, there's 200,000 cases of cardiac arrest, sudden cardiac death in this country, most of which is associated with an acute heart attack. When I started working as a cardiologist at Kaiser Permanente 30 years ago, it was 400,000 per year. Education to quit smoking, to exercise, to avoid or cut down standard American diet, along with medical advancements in early disease detection, the invention of defibrillators, external and internal, and acute treatment of acute heart attack with angioplasty and stenting have effectively dropped the death rate by half. But 200,000 cases per year is still way too high. Cardiac heart attack, heart disease is still the #1 killer in this country. The mechanism of a sudden cardiac death is the development of extremely irregular fast rhythm. It's called ventricular fibrillation or ventricular tachycardia that degenerates into ventricular fibrillation. It's equipped at that point, there is no blood generated from the heart. Now, if you know CPR, do it right away. If you don't, at least you would call the ambulance. But if the ambulance doesn't come early enough, within 2 minutes, the brain will be permanently damaged. In 3 minutes, brain death. And you may be resuscitating a vegetable. So at that situation, every minute is important. A heart attack, when sizable enough, causes damage in the muscle of the heart, which is more prone to rupture as compared to other organs because of the force exerted on the wall during heart contraction. When that happens, death within a few minutes. A heart attack damages the muscle of the heart, make the heart dysfunctional, impair the pumping function. And so the heart doesn't pump properly. The back pressure, all the way back to the lung circulation, create a sense of shortness of breath. And when the pressure is high enough, it seeps fluid into the lung tissue, flooding the lungs, and that is congestive heart failure. Now, those of you who have had an echocardiogram will get a number in your report, and that's called ejection fraction, which is the percentage of blood being ejected by the heart each time it pumps. And the number tells you whether your heart function is normal, mildly depressed, moderately depressed, or severely depressed. When one dies of heart disease, it is going to either from arrhythmias electrically, which is fast, painless, being the best mode of death. It can also die of congestive heart failure mechanically that progress to cardiogenic shock. When the heart doesn't pump enough blood flow to the systemic circulation, the body is deprived of oxygen, glucose, and nutrients, and we go through a dying process. Nowadays, with powerful heart failure medication, artificial life support, artificial heart, a patient can linger in an ICU bed for days and weeks, dying of a miserable death. Now, arrhythmias is abnormal rhythm from disorders of the electrical system, and it ranges from benign skip beat that everybody has to malignant arrhythmias, like what I said earlier, ventricular fibrillation. Now, skip beats such as PAC, PVC, in the absence of underlying structural heart disease, is benign, require no treatment whatsoever. However, the symptom of palpitations can make an otherwise healthy middle-aged man and woman crazy. The symptom of palpitation can be very uncomfortable. And this is ventricular fibrillation we talked about. Somewhere in between is atrial fibrillation, which is common as we age. The upper chamber of the heart, the atrium, instead of contracting, is fibrillating. When that happens, it cuts down the circulations to the lower chamber by 20%. It causes palpitation, fast heartbeat, which is very uncomfortable. Medications to control the fast heartbeat may cause the heartbeat to go too slow, ending up with a pacemaker backup. When the atrium is fibrillating, the stagnation of blood flow causes blood clot, and that can get dislodged. When it travels to your brain, you get a stroke. When it travels to your toe, you get a black toe. When it travels to your gut, you get ischemic bowel. Taking a blood thinner cuts down the probability of a stroke from 5 to 6% to less than 0.5%. Coronary risk factors are factors that lead to the development of cardiovascular disease. Some of them cannot be changed. If your daddy or mommy have had a heart attack at the age of 45, it's bad news because you may have inherited a bad genes. However, genes themselves do not determine disease. Genes function by being activated or expressed. Healthy lifestyle suppress the bad gene and activate the good genes. Unhealthy lifestyle does the opposite. The older we are, the more likely we develop disease of all kinds, including heart disease. But there are two kinds of ages: chronological age and physiological age. You can be 80 years old chronologically, but inside 50 years old, and 50-year-old energetically. Female has a lower incidence of cardiovascular disease until after menopause, when the cardiac protective effects of estrogen is lost. African Americans have a higher incidence of cardiovascular disease and premature cardiac death, partly because of having hypertension, which is more severe and harder to control. Native Americans, Hispanic Americans, Filipino Americans, and Asian Indians from Fiji particularly have a higher incidence of cardiovascular disease, partly due to dietary and hereditary associated obesity and diabetes. But most of the risk factors, and the most common risk factors, are modifiable, lifestyle related. Smoking is well known to cause heart disease in addition to emphysema and cancers of all kinds, particularly lung cancer. When I was in Europe the past 2 months, I've noticed a lot of young people smoke as compared to young people in America. It's kind of unfortunate because the younger you start smoking, the harder to quit. Now, one of the most powerful incentives to quit smoking is to have a heart attack. In my practice as a cardiologist at Kaiser, over the years, I have seen many people who successfully quit smoking the day they have a heart attack. Unfortunately, it's a little too late. On the other hand, it is never too late to help prevent a second heart attack. Hypertension, when the blood pressure is too high, it damages the inner lining of the blood vessel. It leads to the development of atherosclerosis. Hypercholesterolemia, the bad cholesterol, LDH, is one of the components of plaques. The HDL would carry the bad cholesterol to the liver from the bloodstream or to the gut to be excreted. And exercise is well known to increase your HDL. Obesity is now an independent risk factor for cardiovascular disease. So is physical inactivity. Diabetes used to be a risk factor, but it is now understood to be more serious. It is now promoted to be a coronary artery disease equivalent. And what does that mean? It means that if you have diabetes, chances are you already have significant vascular disease. If you have diabetes, your chances of having a heart attack is as high as people who have already experienced the first heart attack. It is coronary artery disease equivalence. We're going to devote a whole section after this on diabetes. If you want to know how risky or how likely you're going to develop acute heart attack in the next 10 years, you go to your computer, type in Framingham coronary heart disease risk score, and put in and check the boxes about the risk factors that I talk about. The computer will generate a number that tells you the likelihood you will have a heart attack in the next 10 years. If you have already had heart disease, or if you are diabetic, and if your score is more than 20, you are high risk. Now, another simple way to know indirectly whether you have cardiac disease is to check the difference in blood pressure between your upper and lower extremities. It's called angle brachial index. The blood pressure in the extremities are supposed to be about the same. The lower extremity may be a little lower. If the ratio is less than 0.9, you have significant disease in the artery supplying your lower extremities. If you have disease in the artery, in the carotid arteries in your neck, chances are you have disease in the artery in your heart. It is simple to detect. It can be done by sonogram. Put a probe on your neck, and you can measure the inner lining, the inner layer, and the next layer is called intimal medium thickness. If it is thick, that means you're accumulating plaques. Can you guys see? Okay. I wonder. Okay. Okay. All right. All right, that's better. Go back one. All right. And up. Okay. So you can see the blockage here in the carotid artery. And you can see the thickness. And you can see the calcium here. Cardiac CT scan. CT scan is very sensitive to calcium. It picks it up. And as you know, calcium is one of the components of plaques. The calcium low, or the amount of calcium in the coronary circulation, correlates with the severity of atherosclerotic involvement. But unless you have a high score such as more than 1,000, it is a source of unnecessary anxiety. During the Korean War in the early 1960s, young American soldiers who died was taken back to the United States to undergo autopsy for medical research without family consent needed at that time. And it was discovered that even in teenagers, plaques has started to form. And so if you got a number which is 400 or 500, indicating you have moderate to severe coronary heart disease, but you have no symptoms, you can go hiking without symptoms, what are you going to do with the number? It causes anxiety. And so my suggestion is, if you have no symptoms, don't get it. And if you have symptoms, get a stress echo instead. Now, as an exercise, stress test is 60% accurate. We're talking about sensitivity and specificity. I mean, in layman's term, is accuracy. But if you add echocardiogram before and after exercise, the accuracy increases to 90%. And it is non-invasive. And there is no radiation, such as if you take a myocardial perfusion imaging. Now, another simple blood test is called C-reactive protein. And C-reactive protein is synthesized in the liver. Illustrated here is a C-reactive protein that adhere to white blood cells and respond to the secretion, meaning the immunoinflammatory factors of the white blood cells. And it forms part of the plaques. When it is less than 3, it's a risk for developing cardiovascular disease as well as cancer, diabetes, etc. Because it's an inflammatory marker, and inflammation is well known to cause many different types of diseases. One of the most amazing medical advancements in the treatment of coronary heart disease is percutaneous coronary intervention, meaning angioplasty followed by stent placement. Instead of having a cardiac thoracic surgeon open up your chest, perform bypass surgery, cardiologists can stick a catheter through the skin into the vasculature, go all the way to the heart, localize the blockage, open up with angioplasty, and put a stent on it. Now, illustrated here is a blocked arteries. It was 99% blocked. After angioplasty and stenting, it's back to normal. Another amazing or remarkable advancement is cardiac electronic device implantation. It improves quality of life and prevents sudden cardiac death, such as a pacemaker, or a defibrillator, pacemaker, and also cardiac resynchronization therapy that help improve congestive heart failure. Now, this is a patient of mine who was the head of San Francisco Fire Department. I have his permissions to use him, and he's happy to be my educational materials. So 15 years ago, he had a cardiac event, got resuscitated, and I put in a cardiac electronic device, and today he's still active. Now, if this is a defibrillator, at the end of the procedure, you need to do a testing, because you put in a device, a defibrillator. You want to make sure when the patient has cardiac arrest, it works. Otherwise, it's embarrassing. And so at the end, you induce cardiac arrest with AC currents, and you bring him back with the defibrillator you implant. If you do it twice successfully, the probability that in real life he would be resuscitated would be more than 95%. Now, but not everybody has a second chance. Our beloved mayor of San Francisco, Ed Lee, experienced and died of sudden cardiac arrest 2.5 years ago, just before Christmas, while shopping at Safeway in San Francisco. Never had symptoms before. His first symptom is sudden cardiac death. And it happened at the peak of his career, 2 years into his second term as mayor of San Francisco. So if you have significant risk factors, sudden cardiac arrest does not discriminate. Doesn't care if you're the mayor of a city, CEO of an IT company, or president of a country. It takes away your life. Now, there's 2 sets of blood vessels that goes to the brain to supply our brain. The carotid arteries, which is palpable in the front of your neck, and vertebral artery at the back of your neck that supply the back part of your brain. Disease in the blood vessels supplying the brain eventually lead to either a stroke or TIA or dementia. 20% of dementia is vascular because of blockage in the blood vessels supplying the brain. 65% is from Alzheimer's disease. However, many seniors has the pathological marking of Alzheimer's disease, which is an abnormal protein by the name of beta amyloid peptide, everywhere in the brain tissue, but without symptoms of Alzheimer's disease, until they also develop vascular disease. Then they have symptoms of Alzheimer's. So it's kind of a mixed dementia, which is the most common, actually. When there's blockage in the arteries supplying the kidney, it eventually would lead to renal dysfunction, end-stage kidney disease, dialysis, and death. When there's blockage in the arteries supplying the gut would go through a dying process just like the heart, except it's more nasty because of the feces and bacteria in the gut. And the infection complication is very nasty, and the death rate, the survival rate is very low, even if it happened in the hospital. So blockage, narrowing in the blood vessels supplying our lower extremities causes peripheral artery disease. Our quality of life depends so much on musculoskeletal system and the function of our extremities. We need our extremities to go places to do whatever we want to do on a daily basis. We need our lower extremities to go hiking to appreciate the wonder of nature. We need our lower extremities to exercise to maintain our health. And so if there is significant disease in our lower extremities, it is pretty miserable. And there is no blood flow, the tissue die. Now when there is dead tissue in your heart, you don't see it. When there's dead tissue in your limbs, you see it. And it kind of scares you. So, now we understand the importance of being arterially healthy. And how to keep ourselves arterially healthy? Lifestyle. The U.S. Department of Health and Human Services recognize that and recommend lifestyle modifications for all Americans. But the best lifestyle is New Start, which is biblically inspired, time-proven to be efficacious. New Start stands for nutrition, exercise, water, sunlight, temperance, air, rest, trust in God. Now in this section, we're going to focus on exercise, because we just talked about disease in the lower extremities. Exercise has many, many health benefits and should be subscribed or prescribed by any provider as the best medicine for everybody with and without disease, to prevent disease and to treat diseases. With exercise, you keep your weight control. With exercise, you lower your blood pressure, lower your blood sugar, lower your bad cholesterol, increase your good cholesterol, improve the quality and duration of your sleep, prevent or at least delay the development of Alzheimer's disease, improve, boost your immune system, improve your mood, and enhance your self-image. People who exercise is well known to live longer than people who don't. Exercise would keep you younger, smarter, and stronger. There are four types of main exercise: flexibility exercise, aerobic exercise, strength exercise, and balance exercise. Flexibility exercise should be done preceding aerobic, strength, and balance exercise to prevent injury to your body, to your joint, particularly. Now, as a split is a form of flexibility exercise. When I was a teenager, I could do it. When I was a medical student, I could do it. When I'm an old man, I can still do it. Now, this picture was taken just 2 months ago at the Colosseum in Rome, Italy. Well, wait. This lady is 92 years old. It tells you exercise keeps you young. Now, the U.S. Department of Health and Human Services recognized this, and it set guidelines for physical activities for Americans. So what does it recommend? For active adults, you do moderate intensity exercise for 150 minutes a week, at least. And what does it translate to? That's only 20 minutes a day. Now, that's not very much. But if you do it, you will live longer. Now, this is the INH Institute of the INH study. It showed that if you only do 50% of it, meaning if you just do moderate intensity exercise for 10 minutes a day, every day, you live 1.5 years longer than people who don't exercise. If you do the whole thing, that means 100% is 3.5%. I mean, is about 3 or a little more than 3 years. And if you do 300%, it's still not very much. That's 1 hour, 20 minutes. Now, 1 second. That's 1 hour. 1 hour of moderately intense exercise. You live 4.5 years longer than people who don't exercise. It's time proven by clinical studies. Now, everybody's iPhone or cell phone has a pedometry. And now it is promoted that you walk 10,000 steps a day, which is a gold standard. Do you know the story behind it? Okay. Now, in 1964, Tokyo was scheduled to hold the Summer Olympic. There was a Japanese doctor by the name of Yoshiro Hateno. He had mixed feeling that his country was holding a Summer Olympic. He was actually a little upset at that time that Japan as a society was getting too Americanized. Not only were McDonald's and Kentucky Fried Chickens everywhere, Japanese people did not exercise enough. He and his team did a study showing that the average Japanese man and women walk only 4,000 steps a day. And he felt a little embarrassed that a country whose citizens are not physically active is holding a Summer Olympic. So just before the Olympic, he invented this pedometry that can record how many steps you walk a day. And he recommended 10,000 steps. So he called on all the Japanese people to more than double what they do a day, walk 10,000 steps. Now, these 10,000 steps today has become gold standard as promoted by the media and health professional. In fact, when you go to WIMA asks you to walk 5 miles a day. And that's equivalent pretty much to 10,000 steps. And with 10,000 steps, you burn about 300 to 400 kilocalories. Now, this is the Grand Canyon as viewed from the east entrance in Arizona. Those of you who've been to Grand Canyon know there's a Colorado River at the bottom. And the elevation drop is about 5,000 feet. There are many trails that go down to the river. One of the trails, the most scenic but challenging trail, is called South Quebec Trails. On May 1st, 3 months ago or so, I went down that trail. It was so irresistibly scenic, I ended up going all the way down to the river in the afternoon. And then I have to go all the way back up on the same day. So I ended up going all the way back. By the time I got back, the shuttle bus has just left, so I have to walk another 4 miles to get to where I parked my car. So that day, I walked 50,000 steps, 20 miles, and 244 floor, which is equivalent to 5,000 feet elevation gains. So the reason I show you this, if me as an old man can do 50,000 steps, you have no excuse not to do 10,000. Now those blue zone places, every single one, the people are physically very active. Exercise improves our quality of life and add years to our life. Now we have about 10 minutes for questions or discussion. Yes?
I'll just say, my father-in-law, we visited him a couple of weeks ago, and he's 92 years old.
Okay.
He used to take a baby aspirin every day.
Okay.
But he told us he stopped taking it because one day he got a little cut and he couldn't stop the bleeding, and he panicked. And he had to have like an elder from the church come over and put pressure on it, and he said, I'm not taking the aspirin anymore. What can we tell him?
Okay. If he has no cardiac disease, do not take prophylactic aspirin because the side effect is much more than the benefit. Now, but if he has had a heart attack, that's different.
And he doesn't go to the doctor anymore, so I don't know.
Well, you encourage him to do a physical every year and seek medical attention as early as possible when he has symptoms.
So we wait for a symptom.
Yeah, but if he's active, he's asymptomatic, you don't need to see a doctor too often. But it's a good idea to have an annual physical exams because you can pick up diseases, you know. Yes?
Calcium is one of the components.
Yes.
Is it okay for us to take calcium supplement?
Well, that's different. Your calcium metabolism is regulated by vitamin D. Your body knows how much calcium should be in the bloodstream. Now, in fact, you know, there's studies showing that calcium supplement is not necessary. Sometimes it probably do more harm than good. Because our diet is rich enough in calcium, especially those of you who drink milk and eat dairy products. But I'm going to tell you what I think about dairy products in our next section. Yes?
I noticed the last slide you had with the blue zones considered
Yes.
life. But I was watching a documentary on Netflix that actually described Okinawa. All the younger people have the same American diet that we have, and so they're not really being considered a blue zone as it was previously.
Yeah. In fact, I was planning to talk about that in my next section. No, but I can talk about it now. You know, all the blue zones, Loma Linda, California, that reflects the lifestyle of Adventists in North America, is the only place which is consistently, over the past 100 years, healthy and live long. The other places get Americanized. That's very unfortunate. And that includes Okinawa, Japan, and Sardinia, Italy. I was in Okinawa 2 years ago. I was not very impressed because I see McDonald's everywhere. Kentucky Fried Chicken, Burger King, you know. So, and that makes a difference. It tells you lifestyle changes make a big difference. Yes? Okay. Yes.
When you're exercising,
Yes.
and you're looking at your watch, and it's giving you the red what's the max? How can you know what's the max to push yourself?
Oh, I see. You're talking about the maximum, the heart
Of
rate
your heart rate.
achieved.
Yeah.
Well, there's a formula that tells you it's according to your age. The older you are, then the higher safety margin you should have. I mean, young people, they can go up to 180, 200 without problems. But when you're elderly, you don't want your heart rate to go up too much. 120 would be good enough. And so whatever set at your watch, I think you have an Apple Watch or something?
Garmin?
A Garmin? Okay, they set the red zone, meaning that don't go beyond that heart rate. Is that right? Mm-hmm. Okay. Yeah, and so, I mean, this is according to the book. But you have no symptom, you have no heart disease. If you go above it a little bit, no big deal. If you feel good, don't worry about it. See, I mean, your symptom is sometimes more significant. If you have symptoms of angina, shortness of breath, lightheadedness, you know you're exercising too much and you need to slow down. But it's kind of a rough safety margin, safety measure for you. But in general, elderly, when you're above 70, don't go beyond 120 beats per minute. If you're young, I mean like yourself, middle-aged, or young woman, you can go up to 150, 140, 150, no problem.
Yeah, the problem is that I usually push myself more, so I want to see what's the max up to. And I guess I'll talk to you.
Well, now tell me at what heart rate you see the red light.
Like 170,
170? Well, that may be why it light up. Well, but don't go beyond 170 for too long,
Okay.
So at 170, you have no symptoms?
No, but
okay.
I mean, I feel, like tired, but I try to push.
Okay, well, you're trying to push yourself, but there's no need to push too hard. Really, it doesn't give you additional benefit to push yourself too hard. Yeah. But 170 without symptom, it tells you how healthy your heart is, how clean your coronary artery is. So, yes. Yeah, well, yes.
To piggyback on Jenny, I don't need it.
Okay. All right.
To piggyback on Jenny. To piggyback on Jenny,
Yes.
my doctor put me on aspirin, and
Okay.
I took a stress test, and I was fine.
Mhm.
And my understanding from you said, don't take the aspirin. Is that correct?
Now, you have no heart disease, right?
I don't know, but I took a stress test 2 weeks ago, and they said it was great.
Then
But
you have-
my family history has tons of heart attacks.
family history is different.
I know, because it's what they ate.
Yeah. But the bottom line is, if you don't have symptoms, the benefit of taking an aspirin is less than the potential side effects. The gastroenterologists are very upset because so many people are taking aspirin, causing.
And so you tell me why my doctor put me on it.
Your family doctor? A Kaiser? No, I doubt it. Now, one second. Now, do you have other risk factors? I mean, hypertension, diabetes, hyperlipidemia, etc.? Borderline diabetic. Okay. That is not enough to take an aspirin. I mean, my recommendation is stop aspirin.
Obese and borderline diabetic.
Yeah. But
Still isn't enough?
no, not enough.
I'm off.
Now, but let me tell you, if you have had a heart attack, unless you have bleeding complication, you need to take an aspirin to prevent the second heart attack or a second cardiac event. It's very clear that the benefit much, much greater than the side effect, the potential side effect, unless you bleed. Yeah. Yes.
How much longer can you wait to eat something after you wake up in the morning?
How much do you want to wait? How long do you wait?
How long can you wait until you eat something?
Now, let me tell you my suggestion. When you get up, you want to drink water because you have not drunk water for 8 hours, and you need to be hydrated. So after you drink 2 cups of water, when you get up, you wait an hour before you have your breakfast.
Yeah, but like only an hour, or I can go longer.
You can go longer.
Like
You can go longer.
now, how much?
You can go to 10, you wait till 10 o'clock or so. I mean, I tell you, I only eat 2 meals a day.
And what? It's
Okay.
Because I go to sleep like around 8,
Uh-huh.
8:30. So, but I don't want to be eating like around
5 o'clock.
4, 5.
Yeah.
But what's happening is if I wait too long,
Mm-hmm.
like 2 hours, when I wait 2 hours and a half,
Mm-hmm.
or almost 3 hours, I feel like this part of my leg,
Is numb?
yeah.
Okay. Well, listen to your body. If you eat something, that symptom goes away, then eating. Start your breakfast. I mean, it could be due to low blood sugar, or the interacting with lower blood pressure in the extremities. There could be different causes. But if by eating food, the symptom goes away, you eat.
That thing is,
Yes,
I have two questions for you.
yes.
I heard of high blood pressure as a risk for heart attack. How about low blood pressure, and how low is low blood pressure?
Okay. Now, usually the lower the better. It cannot be too low without symptom. So the lower without symptoms, the better. Now, but if it's low enough, you will have symptom. It's that simple. And so if your blood pressure is 85, you have no symptoms, no big deal. Systolically. I mean, you are very unlikely to get a stroke with lower blood pressure as compared to people who've got hypertension. But again, you listen to your body. I mean, if your blood pressure is too low, you feel dizzy, you can't function, then it is too low. And if you don't drink enough fluid, your blood pressure can go low. When you get dehydrated, you can go into a shock state. Yes.
If you have plaque in your veins, how can you get rid of it?
Okay. Now, in your vein, it's not much of a big deal. If it's in the artery, that's more of a problem. Yeah. Well, now, in my next section, I'll be talking about diet. And there's an honest diet from a guy who was the professor of medicine in San Francisco California, University of California in San Francisco. And he used angiogram to follow up patients with cardiac disease, with long blocked arteries. And then he documented with strict, honest diet, which is actually pretty close to our vegan diet. After a number of years, a couple of years later, they do the angiogram again. The blockage has receded. It decreases from, for example, 80% to 60%. And so you can improve it. On the other hand, once those blockage is formed, those plaque is formed, it gets calcified. It can only progresses. It can only progress. It can only get worse. And so if you keep it status quo, that sometimes is good enough. And if it's causing problem, you open it with angioplasty. Yes?
Is there a correlation between your blood pressure and your heart rate? Unfortunately, for instance, my blood pressure runs between 106 or 10, and my heart rate usually goes down to about 46.
All right, say it again. When your blood pressure is 110, okay?
Well, my heart rate is usually in the upper 40s, low 50s.
Upper 40 and low 50. Okay, in your case, you may have a mild degree of sinus nodal disease in your heart. Or because you exercise well, you're so well conditioned, all it takes is 40 to 50 beats per minute to keep you active and functional, which is fine. But the two, they can be related because they compensate each other. So for example, when your blood pressure is too low, your heartbeat goes fast, trying to compensate. When your heart rate is too fast, usually it doesn't affect, when your blood pressure is too high, usually it doesn't affect your heart rate until it causes problem, and your heart rate reacts to it. And so, to answer your questions, in your case, your blood pressure and your heart rates are pretty independent. Your body has the ability to auto-regulate how fast your heart should beat, and also your body try to maintain a normal blood pressure until disease occurs, that you have hypertension, requiring medications or other means to control it. Okay, I think
just one more question.
Yes.
Okay, Dr. Chen, the last question, then we're going to take a break.
Doctor, you mentioned about the skip beat earlier, that
Yes.
it would still be normal for some people to have that. How would you consider a 3 successive skip beat? Would that still be benign?
You mean 3 consecutive
Yes.
skip beat? Bum, bum, bum.
Yes.
Well, which is still common. Well, anyway, in the absence of underlying heart disease, this is functional. I mean, the number one cause of skip beat is stress, adrenaline. Your skip beat is very adrenaline sensitive. You're angry, it comes. You don't have enough sleep, it comes. You're upset, it comes, And so even 3 in a row, no big deal. It's not going to cause symptom at all. So don't worry about it.